My name's Bethany. I'm a fourth-year nursing student.
And I'm Jen. I'm also a fourth-year student at Robert Morris.
I'm Adam. I'm a senior.
My name's Jonathan.
I'm Jenna. I'm also a fourth-year nursing student.
And I've never been to Nicaragua, but I'm glad I came.
My name's Dr. Carl Ross. I'm a professor of nursing here at Robert Morris University and also the director of international activities in the School of Nursing. I have been taking students to Central America and Mexico for the past 12 years. This trip that we're going on this time will be my 57th trip. Nicaragua is called Corazón de Centroamérica, which is the heart of Central America. It is located really right in the center area of Central America. It is the largest country in Central America, about the size of the state of New York or Georgia. It is the poorest country in the Western Hemisphere. The purpose of the trip is for the students to experience a transcultural experience in their nursing program. They go down there and they work with the people of the barrio. The barrio is a very poor community, and we work with, as I said, Villa Libertad Annex. And they will go down there, and each student is assigned a family, and when they go into that family, they actually do health assessments on the family, and from that health assessment, they build a teaching plan for the family, and they do health education to that family. Some range as simple as basic hygiene to complex issues of how you control your blood pressure in a cultural context way. The student's initial reaction occurs right in the airport. I sort of tell them your first cultural experience is going to be the airport and the ride to the hotel. In a sense, you're going to now be part of a very chaotic environment. In driving, you'll see we don't stop at the stop signs, we don't stop at traffic lights. Whoever has to go ahead goes. And their impression is like, wow, you know, the rules, there's no rules being followed, it's very chaotic. They're devastated by what they're seeing out the windows. They can't believe the poverty-stricken areas that we drive through as we approach the hotel.
My first impression was that it was completely different than what we're used to.
I mean, I like it. It's a lot different than the United States.
Well, there are traffic lights, but everyone just drives right through them.
I mean, just like, you know, you can't drink the water.
Like the people's houses.
People just like go to the bathroom in the streets. I mean, like, you definitely don't see that in the United States. everything's just like so laid back here.
I think it's a good experience and I like it so far.
And when we go there, we work in a community known as Villa Libertadens, and we work with UPOLI, Universidad de Politécnica. UPOLI is short for that, and it's a school of nursing, and their faculty work with me and their students work with our students. And we work in the community, and it's part of our community health course where the students actually go down there. They're assigned families, and they also work in a health clinic that we have down there. So the students actually triage patients and actually assess patients with me as a nurse practitioner.
We've been here now for 2 days. Obviously, yesterday we arrived, had a great flight and everything. Everything worked out well, and had a fun evening. Many of you have mentioned how much you enjoyed the folk dancing last night. So now that we started to actually do some of the work and we met our families, what I usually do is we sort of sit down and we talk about how the day went. And I would like to hear from you what you thought. We'll start with our first event of the day was when the faculty at UPOLI shared with us the healthcare statistics, the healthcare arena, if you will, here in Nicaragua. So what did you feel about that?
It was kind of disturbing. Knowing all the mothers that die. And
kind of disturbing knowing that the mothers die. How'd you feel about that? Like you said, it's disturbing, and just knowing how some of that is so.
I mean, they think it's not a big deal. To them, it's not a big number. But if that was us, that'd be like a big, huge tragedy if that many people died.
Exactly. And what was the number one reason? You remember the number one reason?
Postpartum hemorrhage.
Well,
It was
Diarrhea.
The kids or
no,
the
that was
mothers?
kids. Kids was diarrhea. But the mothers of the high-risk mothers was postpartum hemorrhage, and that was during childbirth. But even the babies that died in that was malnutrition. You're right.
That's right.
Yeah.
So just think, I mean, malnutrition is something that we take for granted.
Yeah.
And here these mothers are their babies are dying or they're dying during their pregnancy because of malnutrition.
My family has 11 total in it, I think, and they live in a small house, really small house. I don't even know how they all fit in there. They were all female, all of them. I don't know. They didn't say where the husbands were, even if they had husbands or males in the picture. So, I think there's like 5 children under 5, and one of the girls is pregnant now. She's 9 months pregnant now, so it should be interesting. They look pretty poor, and I don't know. It's gonna be tough.
I thought it was nasty when we were in the village, and that lady had all that water saved, and like,
At Adam's house?
is she even gonna boil that, or is she just gonna drink it just like that?
Well, I think that's. What do you think? How would you handle that? You're going into this community now, and you're taking care of this family, and obviously Adam's going to get hit with this. How would you handle that component?
You know, show them how maybe once, and then, you know, put the fire out and then say, now you do it. Or, you know, or I'll make it today, show you how to do everything, and then tomorrow you show me, and then, you know, we can sort of fine tune it as we go along. Because, I mean, that was just, you know, I was standing there looking at this water, and like, I would have to say it was probably about a month old. There was film on it. I mean, it was cloudy, and I'm standing by it. I'm getting bitten by bugs, and that's just, I mean, that's
also
just,
with that, that's gonna promote more insects into their house. Like, you're gonna have mosquitoes there every night on that water.
And if you have mosquitoes, what do you have risk for?
malaria.
Right, so indeed, that's something that Adam's going to want to address with his family is about covering the water. So you have a couple issues here in related to health teaching for them. Number one, the boiling. You have to teach them to boil it. Think about it, though. Here's somebody who's going to have to buy more wood.
That's what I was
For, you know, it's not easy. It's just not easy like it is.
Boiling their water or eating. So
Exactly. Then we have another issue at that house. What's the other issue about the corn for the tortillas?
Mice,
The
rats. There was a dog. There was a dog just
dog.
laying there.
The
and-
can that
and
was
the dog was
sitting
eating.
in there.
The dog. They said the dog eats from there. The chickens, I'm sure, eat the corn on there. So, again, we got to teach them put that corn up away from the animals, cover it, etc.